So without further ado, let's get into the session. And it gives me great pleasure to introduce my colleague, Professor Nick Watson, Chair of Disability Studies here at the University of Glasgow, who will be guiding you through today's session and introducing the fantastic speakers that we have today. I really hope you have a great discussion, and I look forward to hearing everybody's input. Thank you very much. Over to you, Nick.
Good morning, everybody, and thanks very much for joining. And we're really pleased to see such a large number of people interested in what's been what is a very important topic. And I think we all know what a catastrophic impact COVID has had on the 1.5 million people with learning disabilities in the UK. Not only were they more likely than the general population to contract COVID, and to experience poorer health outcomes and mortality because of COVID, but also their services and support networks were greatly disrupted, and this caused a huge disruption to their lives. So I don't want to, we want to move straight on into the speakers very quickly, but what we tried to do is we tried to bring together evidence to look at what's happened in the past, but also importantly, we want to think about what do we need to do to go forward to try and improve things and for people with a learning disability, and to help to make up for some of the disadvantage that they've experienced during this during the pandemic. We're going to draw on research from people with a learning disability that we carried out during COVID, but we also are going to talk to people from the Scottish Learning Disability Observatory to talk about their research looking at the quantitative data, and we're going to ask Eddie McConnell from Down Syndrome Scotland to talk about the experiences of people with Down syndrome from the experience of a third sector organisation. And we're going to draw on some work that has previously done to look at policy implications as we go forward. So if I could go straight into the first speaker, if that's all right, who's going to be Eddie McConnell, who's the Chief Executive Officer for Down Syndrome Scotland, and he's going to be giving a talk, The Good, the Bad and the Ugly, Reflections on the Pandemic from the Perspective of the Down Syndrome Community in Scotland. So thanks very much, Eddie, and over to you.
So good morning, everyone, and very many thanks to you all for the invitation to come along today and offer some reflections from the community that I have the privilege to serve. I've entitled my presentation The Good, the Bad and the Ugly, and that's very deliberate because I do feel at the moment that we're seeing a lot of appetite within the policy officials to talk about what good came out of the pandemic. There's some acknowledgement about some of the things that went wrong, the bad. There ain't much appetite to talk about the ugly stuff, and I'm really keen, even though it is a recorded session, Graham, I'm really keen to be free and frank in terms of the reflections from the community, as I say, that I have the privilege to serve. So my name is Eddie McConnell. I'm Chief Executive of Down Syndrome Scotland. It's an organisation that is 40 years old this year. It has 10 local branches, so very much rooted in the community at neighbourhood level. And we provide support and services and advice to families and directly to people with Down syndrome all over Scotland. We are not a social care provider, and we are what I refer to sometimes as a first order charity. So we are very much a charitable organisation providing services free of charge to people in need. A couple of quick disclaimers at the top before I move with pace through the presentation, because I've got so much I want to share, but I'm really keen to get to the discussions afterwards. So disclaimers for me, in addition to my day job, I'm also the privileged father of a young man with Down syndrome, young Finlay, and I'm going to shamelessly plug his Instagram account. So if any of you want to see what living a good life with Down syndrome is all about, please check out @opswithdowns_. Finlay would be delighted to have more followers on his Instagram account. I also chair the Scottish Commission for People with Learning Disabilities, so I've drawn on some of my experiences and some of the work that great organisation does over there. But on the whole, the views and the opinions that I offer today are directly informed and from families that we serve. We have 1,300 members across Scotland, and from people with Down syndrome in terms of what they experienced. So context, they do say that timing is everything. I, in fact, arrived in post 3 months before the pandemic, so my timing is never great. After my first 3 months, we were keen as a group, as a team at Ginger Scotland to relaunch the charity. And of course, that opportunity was pretty much swept away from under our feet as we began to come to terms with COVID-19. I recall at a meeting of our board in January 2020, under any other business, our chairman said, do we need to think about this virus that's currently being reported? If ever there was an understatement, that was it. So as I said, we were gearing up to relaunch the charity in March 2020 when, of course, national lockdown hit. It resulted in the cancellation of our annual awareness week, a loss of £70,000 to £80,000 of income. We immediately moved to furlough half of our staff group, and eventually we had to make a third of our staff redundant. And we did all of that against the backcloth of a threefold increase in demand for services. And I'll explain where that demand came from and why that demand arose. So that was the challenging context for us entering the pandemic. So let's talk about the good. So the good is that within 6 weeks, we mobilised our online delivery. Like many third sector organisations, we recognised it was really important to keep people connected, keep people safe and keep people informed. Like a number of third sector organisations, we adopted a digital approach and moved quickly, very quickly, to keep people connected, as I say. Our digital approach had additional benefits in that we extended our reach as a charity. So it became the case that it didn't matter where you lived in Scotland, so long as you had an internet connection, we could actually connect with you and connect you with others. So we had people in Orkney being supported by people in Dumfries. So that was a huge benefit, and it didn't matter if you didn't live in the central belt of Scotland, you had equal access to our support and advice and connecting with other members in the charity. Just one qualification to that, of course, we do know that digital exclusion remains a significant challenge for a significant part of the learning disability community. The additional good things to report is that emergency funding became available quickly and was issued on the basis of trust and mutual respect. Really positive moves very quickly by government and also by the big funders to recognise that third sector organisations were pivotal in supporting people in those vulnerable communities, and that funding would need to be moved quickly to them to allow them to respond to those requests and support the national effort in terms of information. We witnessed, and I certainly felt, great collaboration across sectors. It became the norm at the start of the pandemic and through the early first year of the pandemic. We saw brilliant solutions coming forward to really wicked problems. You know, I would give an example of the speed at which a number of the homeless charities, including the Simon community, moved to work across with public sector colleagues and with the private sector to ensure that every single homeless person was actually off the street within 3 to 4 weeks of the start of the pandemic. So that for me was a tremendous example of the kind of collaboration and the brilliant solution to a wicked problem. And of course, lots of people said to us, but that can't be done. And it just shows you what can be achieved when actually nobody cares who gets the credit. And we began to understand quite early on that accessible information was recognised as key. And we did see some really good examples of government in particular recognising the need to go beyond simply the production of easy read to think about how the information could be more accessible to the diversity of communities really affected, and particularly the learning disability community. So that's the good. I make no apology for wanting to talk about the bad and the ugly. I think the best learning from this pandemic in terms of informing new policies going forward will come from an honest and truthful account and examination of what was ugly and what was bad in the pandemic. And I am increasingly intolerant, I have to say, of people who simply want to focus on what was good and brush over some of the really challenging stuff. The reason I focus on that is not to apportion blame or involve myself in any way in recrimination. We were all learning deeply, but we did get some things wrong and we got them badly wrong. So it's really important that we take the time to understand why things went wrong so that we can inform policy going forward. The 5 things I wanted to highlight in terms of the bad. There is no doubt that, as Nick mentioned in his opening remarks, the social care providers cancel support overnight, and in some cases, a number of the social care providers sought continued payment from some families to guarantee a future provision, which seemed remarkable because nobody really knew what future provision would look like, far less when future provision would come back. We began to see the language of the pandemic offering us the first hints of discrimination. With some of you may remember the early reports of early deaths of the pandemic were always qualified with, today we report 15 deaths, the majority of whom were people with underlying health conditions, almost as if it didn't really matter. They didn't really count because they had underlying health conditions. And we knew from the intelligence we were gathering at a local level that underlying health conditions was also a euphemism for learning disability, and in our case, people with Down syndrome. We believe that people with Down syndrome were not recognised quickly enough as being vulnerable and at risk, despite the known comorbidities, particularly around immune dysfunction and respiratory infection. These should have been triggers, we believe, for public health officials to have recognised. And it required a bit of a campaigning and a push, and ultimately required the Oxford University study that included people with Down syndrome and recognised that they were 10 times more likely to die should they contract COVID, and that figure increased exponentially over the age of 40 for the Down syndrome community, as opposed to the general population where it was over the age of 70. And armed with that information and that research from Oxford University, the chief medical officers took the decision, some feel a bit too late, in November 2020, to add people with Down syndrome to the clinically extremely vulnerable group. And more broadly, I have to say, it was quite clear, although we were focused on our community, it was quite clear that people with learning disabilities were increasingly invisible, and significant gaps in data was reinforcing their invisibility. And so to the ugly. One of the things we spotted very early on was, and this came from reports from families, the inappropriate use of the clinical frailty scale to deprioritise people for life-saving treatment. And we intervened very quickly, and I have to say credit to Scottish Government and the Chief Medical Officer's Office for responding so quickly when we were able to provide them with the evidence that some clinicians were deprioritising people just because they had a learning disability or they had Down syndrome, and using the clinical frailty scale inappropriately to deprioritise for, as I say, life-saving treatment. As if that wasn't bad enough, we then started receiving phone calls from our members about them being contacted by GPs and clinicians to open a discussion about the introduction of do not resuscitate orders. I remember vividly one phone call I became engaged with an 81-year-old mum who was really confused because the GP had phoned her to talk about her 40-year-old son with Down syndrome, and perhaps it would be a good idea to put a do not resuscitate order in now, just in case he might find himself in hospital. She was really confused because she had significant health problems. She had a heart condition, and the reason she was confused is she thought the GP should have been talking about her rather than her son. And it was a blatant example of the inappropriate use of somebody's genetic condition, and probably one of the worst examples we've seen of diagnostic overshadowing taking place. These were not isolated examples. There was quite a number of people reporting these conversations taking place with families about putting do not resuscitate orders in place. That cannot and must not happen again. And then we had considerable challenges around fighting to get people with Down syndrome onto the shielding list. So there was a gap between the national announcement and the practice at a local level. And we saw that quite significantly. We were in touch with many GP practices trying to explain to them that people with Down syndrome are on the shielding list and they should be getting access to support and they should be prioritised for vaccination. It seemed to me that there was a significant gap between that national policy intent and statements and what was happening at a local level. And we were often having to inform people locally of what the latest guidance was. And then we arrived into the vaccination world, and I've used quite a strong word here to describe the initial approaches around vaccination were, for us, we felt very chaotic, very disruptive to families, very inconsistent approach across Scotland, and some reports of the use of sedation to sedate people so they could be vaccinated, people with Down syndrome. In one case, I spoke to a mum and a dad who were in their late 70s. Mum and dad had been sent to separate vaccination centres, and their 39-year-old daughter was sent to a third vaccination centre, all on different dates. And the level of disruption and stress that caused to elderly people who don't drive in trying to organise that. I can't understand why a family-centred approach wasn't taken. And it's really important we think about that going forward. And now today we see what we regard as an indecent speed to return to normal, with very little consideration being given to the needs of the most vulnerable. And we saw that most recently with the unilateral announcement of the ending of the high-risk list at the end of this month, with really complex texts being issued to adults with Down syndrome, some of whom misread the text and thought this was an announcement that the pandemic was over and everything was okay. So we saw a really disappointing collapse of the earlier collaboration, the earlier understanding about accessible information and the need to work together. And it seems that this indecent speed to return to the normal is consequently meaning that vulnerable communities are increasingly at risk. What have we learned? I did think of suggesting that I might just say in this slide, what have we learned? Not an awful lot. But let's try and do a wee bit of balance as I close my presentation. I think we did learn that anything is possible when confronted by a common enemy, and as I said before, particularly when nobody cares who gets the credit and we work across sectors and across silo boundaries. We did learn, sadly, that inequality and discrimination lurk really just beneath the surface. So in 40 years of making great progress, what we believe great progress in terms of the disability movement, we were all shocked to see just how quickly discrimination and inequality came forward, and just literally sits just beneath the surface. They often say that truth is the first casualty of war. Well, in our case, I think human rights became the first casualty of this war. Data is clearly king in all of these situations, and if gaps in data exist, you don't exist. And that's really, really concerning, and does link to the previous point around individual human rights. I do think the third sector rose to the challenge. They stepped in and they stepped up, and we were key to the national response, the national emergency response, absolutely key. But I don't think that that's consistently recognised and as such. And I think we're rapidly returning to the place where people tilt their heads when I introduce myself as working for a charity. Oh, that's lovely that you work for a charity, and don't understand the pivotal and critical role that we actually contributed. And I think unless we do something about that status and understanding, then we'll revisit some of these challenges in the future. People with Down syndrome, their families and carers are some of the most resilient people around, but that shouldn't be taken, shouldn't be taken for granted, and for too often it was taken for granted. And many of our unpaid carers were literally on their knees with exhaustion, trying to provide that safe care with very little support. And finally, the mental health impact of the pandemic, I do believe is not fully understood. It's talked about, but I'm not sure it's fully understood. And I think we also need to prepare ourselves for latent trauma to emerge from the past 2 years. I'll finish my presentation to leave you with 2 quotes from 2 people with Down syndrome who have had the privilege to have had fairly deep conversations. Thank you for giving me the opportunity to offer those reflections. It was fast-paced because I'm conscious there are many other speakers today. If you want to be in touch with me, that's my contact details. Thank you very much, and look forward to the discussion later. Back to you, Nick.
Thanks very much, Eddie. That was fantastic and a great scene setting to show us, to talk about the experiences of a particular community, and a really nice presentation. We're going to move on to the next talk, which is by Angela Henderson, who's the Director of Policy and Impact at the Scottish Learning Disability Observatory. And she's going to talk about COVID deaths and outcomes in adults with learning disability in Scotland. She's going to present empirical evidence on this, quantitative evidence. So thanks very much, and over to you, Angela.
Thanks, Nick. And thanks, Eddie, for that really important reflection on the impact of COVID-19 on the population with Down syndrome. And I fully agree with your approach that we really do need to be brutally honest about the impact of COVID on marginalised groups, such as people with learning disabilities. So as Nick said, I'm Angela Henderson and I work at the Scottish Learning Disabilities Observatory, which is based in the University of Glasgow and was set up to address the lack of visibility in data that Eddie mentioned in his presentation about the health of people with learning disabilities in Scotland. So Scotland produces huge amounts of public health data to support policy and practice, but very little of that actually reports separately on health outcomes for people with learning disabilities. And if we are going to address the health inequalities that people of all ages with learning disabilities experience, then we really need to understand the patterns and causes of these health inequalities. So I'm going to start my presentation looking at some analysis. And for me, this experience of doing this study really emphasised the need for better systems for reporting outcomes for the population with learning disabilities, and the urgent need to improve the visibility of people with learning disabilities in data, as Eddie said earlier. And I think this need is essential. It's not just from a research perspective, but also has important clinical implications, which were seen in the rollout of the vaccine, where there were significant challenges were reported in identifying people with learning disabilities to invite them for vaccination. And that was evidenced by some of the conversations that Eddie reported in his presentation. So previous research by the observatory has underscored the need, that the increased risk of death from respiratory disease, and this really in the population with learning disabilities, and this really led us to have some serious concerns about the impact of COVID-19 on the population with learning disabilities in Scotland, and the need for us to quantify this impact. So in May 2020, the Scottish Learning Disabilities Observatory met with Scottish Government and National Records of Scotland to discuss the viability of using Scotland's census data linked to health data sets, including those that report on COVID infection, to investigate the impact on people with learning disabilities in Scotland. And we were granted permission eventually to do this analysis, and were able to link Scotland's census with data from Public Health Scotland's COVID data set. And this was approved by Scotland's Public Benefit and Privacy Panels. And on the 4th of February 2021, so quite a big gap between our kind of initial intention to do this analysis and us actually completing the study, we were able to publish some preliminary findings from this study, which demonstrated that people with learning disabilities were at greater risk from COVID mortality in Scotland, using data from Scotland. And on the 22nd of February 2021, we were really happy that that this study was referenced, and I hope that it was instrumental in the decision for Scottish Government to add people with learning disabilities onto the vaccine prioritisation list. So at the point of us starting out on this study, there was very little good quality evidence on the increased risk of COVID-19 in the population with learning disabilities, and much of the data that was available had significant limitations, including, for example, studies that were mainly focused just on residential settings or using very small subsections of the population. One study which did receive a lot of coverage, which was published by Public Health England, and drew on a number of different data sets which were available to estimate the risk of death from COVID, suggested that people with learning disabilities were between 2.3 and 3.1 times greater risk of death from COVID than those in the general population. And the other study, again, the one that Eddie referred to, which was an early study that included reports on the impact on people with learning disabilities, was by Oxford University. And this study was designed to develop a COVID risk prediction tool, so drawing on data from over 8 million GP records, and they reported a 36% higher risk of death in males and females with learning disabilities, and a much greater risk of death people with Down syndrome. For men, that was 10 times higher, and for women, over 32 times higher. So at the stage at which we were doing this, there was still quite significant gaps in the evidence. It was quite early on in the pandemic. So as stated earlier, at the observatory, we thought it was vital that we were able to produce some analysis to support public health policy making in Scotland and to advocate for the inclusion of people with learning disabilities on the clinically vulnerable list and subsequently prioritisation for vaccine. So the aim of this study was to investigate in the whole population of adults with learning disabilities, COVID infection rates, severe infection, mortality rates, case fatality and excess deaths, and to compare these outcomes with people who didn't have learning disabilities. And the data we had was for quite early on within the first wave of the COVID-19 pandemic. So we had data from 24th of January 2020, which was the date of the first infection in the UK, up to the 15th of August, which was the date at which we extracted data on COVID outcomes for Scottish population. So as I said earlier, we extracted data from Scotland's census, which identifies people with learning disabilities, asked people if they had a learning disability. We found that this data, which is this questionnaire, which was rigorously tested with the population prior to the census, is a robust method of identifying the population within Scotland with learning disabilities, and it covers the whole population and everybody within private households. And we were able to link this to COVID-19 laboratory test results that were held by Public Health Scotland, hospital admissions to look at hospital admissions due to COVID, and of course death registrations. So overall, we had just over 255,000 records that were successfully linked to the Community Health Index spine, and that resulted in over 17,000 records for adults with learning disabilities, and almost 165,000 linked records for our 5% general population comparison. And as expected, there were more males than females in the learning disability cohort. So with this data, we first conducted a crude analysis of the outcomes of interest. So we found 126 laboratory confirmed infections in the learning disabilities group, and 871 in the much bigger general population comparison group. which equated to 905 infections per 100,000 for people with adults with learning disabilities, and 521 per 100,000 for people in the general population. For severe infections, which were classified as infections that resulted in either hospitalisation or death, we found 75 people in this group with learning disabilities and 404 in our 5% sample with no learning disabilities, which equates to 538 people with learning disabilities per 100,000 experiencing severe infection, compared to 242 per 100,000 in our comparison sample. Overall, in this short period of the pandemic, we identified 36 deaths in the population with learning disabilities. So in summary, based on our sort of initial crude analysis, we found that people with learning disabilities were almost twice as likely to become infected with COVID-19, over 2 times more likely to have severe infection. And in terms of case fatality, 28.5% of people with learning disabilities died following COVID infection, compared to 22.3% of the general population. But in order to account for some of the differences within these groups, we standardised our analysis for age, sex and deprivation to ascertain COVID mortality ratios. So overall, we found that people with learning disabilities were 3.26 times more likely to die from COVID than people in the general population following standardisation, that the risk for males was greater than that of females at 3.7 times. And the mortality ratio was also higher for those in the least deprived areas at 3.9 times greater risk. And for the younger age groups, mortality risk was even higher. It was 7.47 times higher for adults who were aged 54 or younger, and 19 times higher for those aged between 55 and 64. However, because there were relatively small numbers within this, there isn't quite a large note of caution with these breakdowns, and you can see that within the wide confidence intervals. So in summary then, when age, sex and deprivation were taken into account, people with learning disabilities were 2.6 times more likely to have severe infection, that is to either to an infection that resulted in hospitalisation or death. Males were at greater risk of death than females, and those in younger age groups as well were at much greater risk. So again, what we heard around the time of the first wave of the pandemic was very much an emphasis on the risk factors for older people in terms of COVID. However, when we look at data from the learning disabilities population, we find that adults of all ages are at significantly greater risk of severe infection or death. So one of the final aims of this study was to investigate excess mortality, also due to COVID, to really look at the broader impact of COVID on deaths in the population, to investigate whether there'd been an overall increase in all-cause mortality in 2020, during the first phase of the pandemic. So to do this, we looked at the average standardised mortality ratio for the same period, that is January to August, for the previous 5 years before the COVID pandemic. And in the 5 years before the pandemic, the standardised mortality ratio was 2.39 times higher. So the risk of death for people with learning disabilities was 2.39 times that of the general population, even before COVID. And what we observed was that when we looked at the all-cause mortality in 2020, that actually the standardised mortality ratio had increased only slightly to 2.5. And for us, that really demonstrated that the learning disabilities, the pre-existing health inequalities that people with learning disabilities experience is really, there's already a pre-existing excess mortality within this population. So in summary, overall, our study found that adults with intellectual disabilities were more likely to be infected with COVID-19, and that they had a worse prognosis once they were infected. So they were twice as likely to become infected in the first place, 2.2 times more likely to have severe infection resulting in hospitalisation or death, and had higher case fatality than the general population. So the risk of severe or fatal COVID relative to those in the general population was much higher in the younger adult age groups, and particularly in the age groups between 55 and 64. And interestingly, when we looked at excess deaths, we didn't find a huge increase in excess deaths, which we really attribute to the fact that of pre-existing health inequalities in this population. There were quite a number of limitations within our studies. So because we did this study early on, the data that we were able to access was for a short period right at the beginning of the pandemic. So there were a small number of cases that reduced the reliability of our results. And a high probability that there was an underestimate of potential infections, because our study only looked at laboratory confirmed cases, and at the time of our study there was very limited access to community-based testing. And as Eddie's said, the risk to people with Down syndrome was not reported in our study because we weren't able to disaggregate data within the learning disabilities population, and we also weren't able to look at the differential impact of COVID on people with more severe learning disabilities compared to those with milder learning disabilities. But the implications for us were still quite stark. We advocated for the importance of non-pharmaceutical interventions, so access to personal protective equipment, which were vital in minimising transmission, particularly in a group of people who perhaps had more people coming into their daily lives to provide care and support. Critically, we were advocating closely with the Scottish Government to include all adults with learning disabilities on the vaccine prioritisation list. And I think this study does indicate that there's a real need for further analysis of data of subsequent waves of the pandemic, including the current period. And also a better understanding of what the specific risk factors are for people with learning disabilities that lead to increased risk of mortality and severe infection. And as I said, in conclusion, this study was important because it did quantify the overall increased risk of COVID-19 infection and mortality, and underscored that people with learning disabilities had a worse prognosis when infected. So from the observatory's point of view, we're keen to analyse further waves of data in Scotland, to analyse outcomes also for people with autism, and to investigate further the risk factors for COVID infection and mortality in the population with learning disabilities. Thank you very much. I know we're not taking questions, so I'm happy to answer any questions in the chat or in the later discussion. Thank you very much.
Thanks, Angela. That was great. It's been a really grim morning. Not in terms of the quality of the papers, it's just the stories, and I don't know if it's going to get much better. Can I just check? Is Nat, are you on? We've got Nat's trying to is coming in from Zambia at the moment, and I understand he's lost his internet connection. Is that right?
I don't think he's back yet, Nick.
Not
so
back yet.
yeah.
Could we ask Amanda and Roseanne, are you ready to step in? Can you? Right. Okay. So sorry, we'll hopefully get Nat back on. We've got Roseanne's coming in from Palestine this morning, I think, isn't that right? And then Nat from God, it's a different world. Okay. Right. So we could move to Amanda Galuli and Roseanne Maguire, who are going to talk about the implications of policy and practice there from the Institute of Health and Wellbeing at the University of Glasgow. So over to you two. Thanks.
Thanks, Nick. Hi everyone. So Roseanne and I are going to be talking about some of the findings from the coronavirus and people with learning disabilities study today. So this study has been led by Professor Chris Hatton at Manchester Metropolitan University and Professor Richard Hastings at the University of Warwick, and funded by the UK Research and Innovation Medical Research Council. So the survey aimed to examine how people with learning disabilities coped with the unfolding events during the coronavirus pandemic. We recruited participants from across the UK, from Scotland, England, Northern Ireland and Wales. And the teams in each country worked with collaborating partners supporting people with learning disabilities. So as you can see from this slide, there was a lot of different organisations involved. In Scotland, the project has been led by Professor Andrew Jahoda, and Andrew, Roseanne and I have been working with the Scottish Commission for People with Learning Disabilities and PAMIS on this work. So we had two groups of participants. We directly interviewed adults with learning disabilities via Zoom or by phone call. And for adults with more severe learning disabilities who were not able to take part in an interview, there was an online survey completed by family members or paid carers on behalf of the person they support. So we interviewed and surveyed people 3 times across between December 2020 and the summer of 2021. And at the start, we spoke to over 600 adults with learning disabilities, and almost 400 carers completed an online survey, with 166 people completing an online survey on behalf of the person with PMLD. And so a big thank you to everyone who took part. We're really grateful for everyone sharing their experiences with us. So a broad range of topics were covered in the interviews and surveys, including health and wellbeing, health and social care services, digital use, friendships, and the impact of caring. The surveys and interviews were developed with direct consultation with the advisory groups of people with learning disabilities and family carers in the 4 nations, and with direct consultations before each of the new survey waves, so that any new emerging issues could be included. And after the surveys in Scotland, we held dissemination events attended by family carers, people with learning disabilities, organisations, and the view that these events really helped with the interpretation of the research findings and guided the development of recommendations which came out of the study. So today we're going to be talking about some of the key findings from the research and the recommendations in relation to these. We will be talking about UK data, but the findings across the 4 nations are largely similar. And the recommendations were within a Scottish policy context, but they are general and so could be considered within other contexts. So people with learning disabilities were worried about the coronavirus across the year, with the greatest worry being people were worried about their family or friends getting coronavirus. When we last spoke to people in August of 2021, 70% of people were worried about family or friends getting coronavirus, and 58% of people worried about themselves catching coronavirus. There was also an impact on people's emotional well-being and feelings of loneliness. When we first spoke to people in December 2020, the majority of people with learning disabilities reported being worried, sad, angry and frustrated, and lonely with no one to talk to. When we spoke to people in summer of 2021, while things had improved a little bit, the majority of people were still worried, sad, angry, frustrated, and 41% of people reported being lonely. Similar findings were also reported by the carers of people with more significant learning disabilities. At wave 2, the majority of people with more severe and profound learning disabilities were reported to experience anxiety, sadness, and anger and frustration, with very little sign of improvement by our third wave in August 2021. So based on these findings and the views of people within our dissemination events, the following recommendations were made. Firstly, there needs to be additional funding and resource to ensure support is provided to those whose emotional well-being has been negatively affected during the pandemic. And secondly, official communication was reported to contribute to anxiety, so future communication should be more easily accessible. Suggestions by people with learning disabilities included increasing font size, use of colour, and presenting information in alternative formats, such as audio and video. We also asked questions regarding access with health and social care professionals. Over 64% of people with learning disabilities and people with more significant learning disabilities were reported to have had no contact with health professionals at the final wave of data collection in August 2021. Where there was contact, this was more often remote compared to face-to-face. For example, 20% of people with learning disabilities had virtual contact with their GP compared to 14% face-to-face. And of those people who usually have an annual health check, less than 40% reported that they had had their health check in 2021. 40% of people had also been waiting at least 6 months for a medical test, operation, or hospital appointment. For people with more significant learning disabilities, there was a bigger gulf between virtual and in-person GP consultations. And this is particularly noteworthy as many people with more significant learning disabilities would be less able to verbally report on their symptoms of distress. Less than a third of people with significant learning disabilities were reported to have had an annual health check in 2021. 44% of people had been waiting at least 6 months for a medical test, operation, or hospital appointment, and 1/5 of people had a medical test, operation, or hospital appointment cancelled in the last month. Over a quarter of people were also reported to have had a new or worsening health condition in the last 4 weeks. Based on these findings, the following recommendations are made with regards to access to health services. Consideration needs to be given to prioritising face-to-face GP consultations for people with learning disabilities, particularly those with more severe learning disabilities. Annual health checks for people with learning disabilities need to be prioritised going forward. And addressing any deterioration in the health and well-being of people with profound and multiple learning disabilities needs to be a priority of allied health professional services. Okay, I'm going to move on to Roseanne. I'm going to take over here.
Unmute myself, thank you. I'm Roseanne McGuire and I worked on this research project with Andrew and Amanda at Glasgow University. As Eddie has already mentioned, the closure of services for people and the lack of support at the beginning of the pandemic had a dramatic effect. Over a quarter of people with learning disabilities and 58% of people with more severe learning disabilities had used day services before the pandemic started. And at the first wave of data collection, almost all day respite and support services, community activities had stopped. But by August 2021, we can see that almost 2/3 of people are back attending in person, with some attending online. But it's stark to see that 27% of people with learning disabilities and 37% of those with more severe learning disabilities had not yet returned to day services in person. Now, we don't know how many people, the extent to which people have returned to their day services at pre-pandemic levels. But we do know that, for instance, 9% of people in cohort 1, which is people with learning disabilities, and 25% of people in cohort 2 had only been attending the day services less than once a week. And around about a fifth of people in both cohorts were back 4 to 5 days, but we don't really know too much more. Sorry, Amanda, can you? Thank you. So we know support has not returned to pre-pandemic levels. And now many people are still getting less support. As you can see, that, sorry, excuse me, by the final time point in August 21, slightly more than a quarter of people with more severe learning disabilities said they were receiving less support. And over half of carers of people with more severe learning disabilities were receiving less support. Now, this pandemic brought to the fore long-standing concerns about access to support and services for people with learning disabilities, particularly in relation to contingency planning and young adult transitions. For families and people with learning disabilities, it heightened their sense of vulnerability. They were expressed many fears about particularly what would happen if they were to become ill themselves with COVID. And these concerns highlighted the lack of funding that they've been used to for many, many years, and also the disparity between policy aspirations and the everyday lived experiences of people with learning disabilities and their families. In terms of recommendations, unsurprisingly, the view was the full reopening of day services and community activities for people with learning disabilities to be prioritised. Provision of online support should be an addition and not a replacement for in-person support. And it was suggested that there should be a national hub where ideas for best practice could be collated and shared across Scotland. Perhaps some of the examples that Eddie gave could then be looked at in relation to what we can do now. And this might include day services, community activities, access to allied health professionals. The key thing was that the hub should work in partnership with people with learning disabilities and their families. As has been said before, families have struggled to cope with greatly reduced levels of support, resulting in negative impacts on their physical and mental well-being. And the pressure on families is unsustainable, and it was very much the voice of carers with people with learning disabilities that people with PMLD the care packages need to be reinstated. Broader consideration needs to be given to the ability of families and people with learning disabilities themselves in order that they can help plan their transitions, including their move from the family home. The feeling coming very strongly from people with learning disabilities and family carers was that the rhetoric should be in line with reality. We don't know, the survey didn't tell us how many people were engaged with community activities prior to the pandemic. But at the last wave of survey data in August 2021, we know that 45% of people were attending community activities in person, those people with learning disabilities, and 11% were involved in online activities, whereas 36% of people with more severe learning disabilities and 6% of those were doing online activities. Quick mathematical calculation would then tell us that 44% of people with learning disabilities and 58% of people with more severe learning disabilities were not involved in any community activity in August 2021. So without this support and opportunity to engage in social activity, people will become more lonely, depressed. This is an essential aspect of support. So it's recommended that proactive measures should be taken to support people's need for social contact and activity. And there is a need for both online and face-to-face services. During the pandemic, 92% of people with learning disabilities at the last wave of data collection were using online, and 74% of people with more severe learning disabilities had access to the internet. If we look at what they were doing in August 2021, 61% of people with learning disabilities compared to 34% of people with more profound learning disabilities were still enjoying being engaged in online activities. Whereas 26% of people with learning disabilities, 44% of those with more severe learning disabilities had never been keen and were not keen to be involved in online activity. So whilst people with learning disabilities should be supported to use online platforms, particularly those who develop lots of new skills and a real enthusiasm for online, building in new opportunities for digital engagement, online activities should be an addition to, though, rather than a replacement for face-to-face activities. Specialist online activities and supports are required for people with more severe and profound learning disabilities, but it should also be acknowledged that for some people, online resources are not appropriate. Now, it's already been said by Eddie, and we all know the impact of caring on the carers who were left on their own, many of them having to cope by themselves. And this impact continues. Over 50% reported feeling general feelings of stress, tired and disturbed sleep, with 40% feeling depressed, 34% by the time we got to wave 3. So some people are still leading very restricted lives. 19% of people in August 2021 were still shielding. And for people who didn't live with family, half had some restrictions imposed on visits from family, friends or professionals. And
Hi, Roseanne, sorry to butt in. 1 minute, is that okay? Thanks.
Okay.
Sorry, yeah, it's just a 1 minute warning. Sorry, that was.
All right, sorry, right, oh God, sorry, 1 minute more, sorry, Nick. Right, so for people who didn't live with family, half had some restrictions and 5% were still not allowed any visits from family or friends. So just to say that this had a very negative impact, carers report a very negative impact on people, over 55%. Last slide, Amanda. So recommendations for this was that anticipatory care plans need to be put in place, and in the event that carers become unwell and are unable to continue their care role. But there needs to be a mandatory duty to implement the care plans. It's not enough just to have it. And in relation to any future visiting restrictions, there's a need for individualised risk assessments that take account of individual factors and put the person with the learning disabilities at the centre of the risk assessment process. The key thing is that people with learning disabilities and their carers are involved at all stages of any assessment processes. I'm going to finish very quickly by putting up one slide from a little video clip from people that were involved in our advisory group, saying what they want to come out of all the research that's been done.
What do you hope comes from the project? So we've got the findings now. So what would you hope that happens with the findings?
It's going to help organisations become better, because the information that they've managed to get from the researchers and from interviewing people with learning disabilities, it'll make organisations grow better because they'll have a better understanding.
And one thing I'd hope that comes out of this is that we aren't pushed to the end of the pile of the papers again, that we're actually put on the top and made a priority.
Thanks very much. That was, sorry. Thanks very much. That was great. And unfortunately, Nat can't be with us. But what I'm going to do is I'm going to give the talk, because I did this work with him. So why won't this let me share the screen? There we are. That's the wrong one. Right, okay. Oh, I can't get the notes. Is that okay? Is that all right? Yeah. Okay. So this is some work. I'm sorry. I'm not gonna get this as well as Nat because I can't get at the notes and share the screen at the same time. But I'm going to try and give the talk. But I was involved with Nat in writing this paper up, so it won't be as good as him. But I will try and see if we can get through it. So I think the first thing to say, and I'm going to build on. We're going to present some data from the study we did, looking at the experiences of people with disabled people in general, but we're going to look specifically at the data on learning disability. And I think to frame this at the start, it's really important to say that the health and social inequalities experienced by people with a learning disability are not new. I think this is one of the things that's come through. It's part of it's been there for a long time. We know that, I mean, work that Angela was involved in as well with the Scottish Learning Disability Observatory showed the increase. The increase in illness and comorbidities for people with a learning disability, and I think their study showed that something like by the age of 20, people with a learning disability had the same level of comorbidities as people in the general public at 55. So I think this to say that this is all it's part of this, and we know the social inequalities experienced in terms of employment and so on, with 6% of disabled people with a learning disability being in jobs. So I think to say that this is all framed within that. One of the things that I think there's a danger that we come through when we talk about the data that Angela gave and the description that Eddie gave and so on, is that we see that this vulnerability, that we see people with learning disability as being vulnerable, and that vulnerability is inherent to them having a learning disability, rather than being the result of the way that society is organized. But as well as that, they're made much more vulnerable to getting COVID and much more vulnerable to the impact of COVID by the structures that marginalize, exclude, and actively harm them. We know, I mean, Angela talked about the inequality in the social, the health inequalities that interfere with learning disability to make people more vulnerable to COVID. And people with a learning disability are more likely to live in poverty. So they're more likely to face both they've got and so these two will combine and reinforce each other. And that so as well as having sort of a biological, if you like, vulnerability, they've also got a social vulnerability. And I think those two, but we seem to be focusing too much, I think, at times on the biological vulnerability rather than on the social vulnerability and the way that we create people with not we here in this talk, but there's a danger that the media in general talk about that and create create that. So this is based on a series of interviews. We did 2 interviews with people with learning disability, 13 adults, 6 caregivers or family members of adults, and 5 caregivers of children, and 31 key informants from organisations of and for people with learning disability in England and Scotland. We carried out these interviews by Zoom, or in a couple of cases by email, and we interviewed people twice, at the start of the pandemic, in June 2020, and then a year in February to April 2021. We talked about work, we talked about education, we talked about leisure, we talked about social care, health, and government response to the COVID pandemic, and when we talked to people about how they went through. I think I want to talk. There was a lot of things that emerged, but I want to talk about 4 key themes that emerged across. The first of these was the limited inclusion of people with a learning disability in pandemic response strategies, how they were completely forgotten about, and how services didn't take into account their needs. The second is on the suspension, the impact of the suspension and removal of social care, and how this impacted on people with a learning disability and their families. And I think this is adding to both work that Amanda and Roseanne talked about and Eddie talked about. And the third one is the impact of the pandemic on people's everyday routines and the way that the pandemic left many of them isolated. And the final point I want to talk a little bit about is the initial lack of vaccine support for people with learning disability and the fight for prioritisation and how this impacted on their lives and what it tells us about the way that people are made vulnerable. So I think the first thing we'd say, you know, we titled this Afterthought, Lack of Thought or No Thought. And I think it's hard to tell whether it was that they just didn't care, but people with learning disabilities felt invisible and ignored in the national response to the pandemic. Initially it started, and this is from Kelly in England in the first round of interviews. She said, when I watched them, news briefings she was talking about with mum, I never once heard the word learning disability. We were completely forgotten about. And then she got very close to crying. She said, do they ever think about people like us? But could they care less? No. Do they care? No. And I think one of the things that we have to say at this time, that this leaving people out, ignoring them and making them feel, actually increased the anxiety because they didn't feel that they were included in anything. And it made people feel more concerned and more worried about the outcomes. And I think at the root of this problem was neglect and a limited understanding across the nations and among national and local actors on the needs and the way that people with a learning disability lead their lives. And this is from a chief executive officer of the National Learning Disability Organisation, said, I inveigled myself into a meeting of local authority senior management quite recently. And I was just fascinated about how little they knew about people with learning disabilities and how little they knew about people in their communities who had learning disabilities. So I think we talk about this lack of thought, is it whether an afterthought, a lack of thought, or no thought? And I think it is this, just no thought. People just didn't consider people with a learning disability at the start because I think people didn't understand generally their needs and they weren't seen as very important. The lack of engagement and understanding is illustrated by the failure to provide information and guidance to people with learning disabilities in multiple and accessible formats. And this, I think, fits a lot with what Roseanne and Amanda just said. So this is from Poppy. So the government should give more information. That's what I think. They should get more information. And I think they should explain it more to people with learning disabilities because some people don't understand what they're saying. Because I found out that their words, that they're using big words, not little words. They won't break it down. I think there's a clear lack of people just didn't know what was going on. And this, again, really increased anxiety and created vulnerabilities within the people. I think, again, this echoes a lot of what both Eddie and Rosanna and Amanda have said. There was a complete dissolution of care and support. So at the start of the pandemic, many people saw their social care packages cut. Social care was removed overnight with little warning and no previous word and no further word from providers and no suggestion as to how or help with or ideas about how this social care could be removed. So this is from Chris, a mother of Jim in Scotland. So the day centre called me about a month ago to say it was time for his review and they perhaps could, and many received, no further word from providers. I mean, Chris told us in the interview that Jim's social care was just removed overnight. She was phoned up, told the social care was gone. Then they didn't get in touch. So the day centre called me maybe a month ago to say it was time for his review. And could they come round to do the review in the garden? I said, are you having a laugh here? You haven't seen him for 5 months. What is there to review? And I think there was just this complete lack of going on down there. People received little or no guidance from the government or local authority for how they could get support in their home or how they could make that support COVID secure. There was a lot, if you remember, at the start of the pandemic, there was a lot of talk around PPE. But this PPE was the concern for PPE was for hospitals and for care homes. Very few people talked about providing PPE for people living in domiciliary care, for people living in their own homes. And people simply couldn't get hold of it. And people weren't told how to make their home COVID secure if they had personal assistants coming in every day. We were told of occasions where staff who normally work with people with learning disabilities were transferred to work to care of the elderly people. People were told, well, you're working care, we want you to move in care of the elderly. And we don't think it's almost as if suddenly the pandemic meant that the needs of people with a learning disability disappeared overnight and everybody was focusing on older people. So the shift of care staff also meant a lack of consistency in the delivery of care. And Donna, a mother of Ryan, said to us, it made me understand that there was a complete lack of awareness of caring for someone in your own home in a national breakdown. 24 hours a day, 7 days a week, and not being even able to go out for work. That's unforgivable. I mean, I think one of the things I want to say, because I'd say here, one of the things that we talk about here, there's a danger, we talk all the time about how dreadful it is to have a learning disability. And we create the idea that having a learning disability it's a learning disability that's the problem. But that same person also did say, she said that it was really nice to spend 12 months with her son. She hadn't done that because she'd been rushing in and out of work. She hadn't done that for years. And she said it was just nice for them to spend all that time together. So sometimes there's a bit of good that comes out of it. But this is the dissolution of care. And this is from Abby, the sister of Morris, who was also his care provider. It says, I think they feel that it's like people with disabilities are making special demands, wanting special treatment. But actually, that's not really it. They just want the same outcomes as other people. They just want to live their lives. And I think there was a lack of recognition of what it was that people wanted. I think with services closed during the pandemic, many participants felt really isolated and lonely. There was a sense of loss and worthlessness. And this again added to feelings of anxiety and distress. And this is from a CEO of a national learning disability organisation. That was really hard, you know. People were saying they felt they'd lost their children, that their child was now so low in mood and, you know, lethargic, not carrying out activities, self-injurious behaviour, communicating in adverse ways, had put on weight, lost skills, not able to do things that they used to be able to do. And a couple of families saying, I don't know whether I'll ever have my son back again. So this disruption of care created real problems within in terms of people's mental health, people's well-being and people's anxiety. I think that the other thing that happened during the pandemic with the closure of services and so on, for many people with a learning disability, their communities are built around day services. So they meet their friends when they go to when they go to the drama group or to the lunch group or to when these closed, their communities went and people became really lonely. And this increased anxiety and increased feelings of separation and loneliness. And a couple of people we spoke to had episodes that required psychiatric intervention because they were so low and so lonely during the pandemic, because nobody had spoken to them and nobody had seen them. And some people, one of the people ended up, I think, you know, the routines got so disrupted and they just didn't know where to go. I think one of the things to say is that it's not all doom and gloom, because I think Eddie talked about this, that the third sector response was outstanding during the pandemic across the country, and without the flexibility, without the way that the third sector turned the ways they work around, the outcome would have been much worse than it was. They immediately, I mean, Eddie talked about they went online very quickly. Lots of organizations just changed the way they worked overnight. They went online, they ran online groups, they provided mental health support, they provided Zoom training, they went out. And I think one of the participants with a learning disability I spoke to said that, you know, suddenly she lived in Inverness, and she said, I've got friends in Plymouth, because these online groups became national and people started to talk. So I think, as well as the disrupted routines, one of the things we have to talk about is in terms of the positive, was the way that the third sector responded and the way that they were able to come together, and actually they filled the gaps and they compensated for failures by the state, where the state had failed to step in and pick this up. I think one of the things I'd like to say about the disrupted routines and the lack of service was that we have, in both England and Scotland, we have the Minister is the Minister for Health and Social Care. But during the pandemic, they became the Minister for Health. Because one of the problems is, I think, that it's really difficult to have the bandwidth to focus both on the real problems that the health sector were experiencing, and also to take account of the social care. And nobody was speaking for social care, and it's one of the problems I think we've got with integration, is that health has dominated, and it's one of the things that we need to think about if we go through into the forward, is how we stop this happening. And the final point I want to focus on is people with learning disabilities were initially ignored for vaccine priority, despite early evidence that they had a high risk of morbidity and mortality. And Angela has talked about this, Eddie. And so I was at a meeting, this is a CEO again from a disability organisation. It's not all the same CEO, so don't it's not all one, it's a different one. I said, so that what I'm actually saying, trying to help with here, is the efficacy of the administration of your vaccine program. And the response I got was, that would be taking somebody else's vaccine. And I think there's a real danger that one of the things that we happen with the vaccines, it took national campaigns by advocates and particularly by siblings, by nationally known non-disabled people speaking about their siblings to bring this to the fore. It wasn't done on evidence. It was done around campaigns like Joe Wiley and other people who brought this out to the fore, and it wasn't being done. So I think again, this sort of shows the way that people with learning disability were made vulnerable, because they weren't considered, their needs weren't considered. And even when people were placed in a priority group, there was often no accommodations made at the vaccination centre. It's the same building, there's no facility. There would be uproar, wouldn't there, with no wheelchair access to a building for vaccinations. But that is exactly the same, accessibility. So people for whom being in rooms with lots of people, lots of other people become a problem or a challenge, found it very difficult to go to vaccines. They had to queue up for long times, and there wasn't accommodation made to meet their needs. So I think the thing to say is that to finish the discussion, I think just to say that people with learning disability were neglected. I think that's quite a common theme that's run throughout everything people have said today. Government action and inaction expose people with learning disabilities to real harm and damage. And I think the pandemic, if it's revealed anything, it's revealed how poorly their needs are understood and how rarely people with a learning disability are considered in policy planning. It's exposed the gap in knowledge, and it's exposed the fact that actually we don't really think about them, and we need this redress in government policy that Roseanne and Amanda so clearly sort of articulated. And just to finish with this final quote from Sally from Scotland, she said, I think we've just been pushed under the carpet because I don't think the government give a damn. As long as they're okay and they've got their wage packet, they don't give a, excuse my language here, they don't give a toss. And I think that's how people with learning disability, that sums up how they felt they were exposed during the pandemic. So thanks very much.